So seat of action we are going to talk and discuss about. Before we talk about seat of action, of course in homeopathic practice you have heard about this term. When we read Medica, we see seat of action, sphere of action. Very prominently the speakers or the authors, they talk about this. But before Hahnemann, there was a physician called Paracelsus who actually started working on a principle called law of likes. The homeopathic principle is about law of similars. Paracelsus was the person who started talking about law of likes. What does that mean? What was his way of practice? Paracelsus' practice, the way of practice, was actually about finding out the drug which acts on the organ. Seat of action was his main principle in governing to find the remedy for the economy, for the diseased patient. And Paracelsus worked on that principle. In fact, he worked so much that there were people who started following it. And there were definitely some good results. He used to call them remedy appropriata. What is remedy appropriata? Remedy appropriata means an organ is affected, a remedy which is appropriate to that organ is called a remedy appropriata. Among all his followers, there was a person, a physician came up known as Rademacher. Rademacher became very much influenced by his teaching and he started teaching it vigorously to the people. So much so that a school of thought emerged out of it. Rademacherians, like we called to the soldiers. There was a group who used to be called Rademacherians and he gave the name Paracelsus Medicina. Medicina Paracelsia. And Rademacher was a person who started talking about the sphere of action, the seat of action, finding a remedy for the organ actually. Now then, what is the difficulty and what is the confusion between, or what is the difference between homeopathy and Rademacherian approach or a Paracelsus approach? Paracelsus, there is not much difference if you understand. The knowledge of drug, see, whatever way you give the remedy, but the first thing is you need to have the knowledge of drugs. So homeopathy, when you talk about homeopathic gaining of knowledge, how does a homeopathic system gain knowledge? You all are aware of it. Proving on healthy individuals and the symptoms which come up, they are written down in the provings, Mater Medica Pura, and from those symptoms we understand the drugs, and when it is available in the patient, similarity is there, we give it. What about Paracelsus or Rademacherians? These Rademacherians were also called organopaths later on. So organopathy, the term that you use or you hear about organopathy, is basically the Rademacherian school of thought. Rademacherian or organopaths, I will now start speaking about organopathy. So when I say organopathy, you have to connect with Rademacherian or Paracelsus thinking process. Organopaths, the way they got knowledge about the drugs was through doctrine of signature, from diseased individual, from trials, from experimenting, but from diseased individuals. And this was the basic difference between a homeopathic system and organopathic system. But slowly what happened? Slowly as homeopathy started gaining popularity, the results were good, symptom of understandings were good. Slowly and steadily, the organopaths started using proving symptoms to gain knowledge about the drugs. Because just imagine, if you have a drug and you are solely dependent on doctrine of signature to understand the symptoms of the drug, the utility of the drug, or you are totally dependent that a diseased individual will come, I will try and test and then I will understand, your knowledge of limitation is there. Limitation of knowledge comes in. And maybe that was the reason why organopaths slowly and steadily adopted Hahnemannian or homeopathic system of proving the remedies and gaining the knowledge. So specificity of seat of action. So there are two terms that are being widely used in ancient history of medicine. Medicina Hahnemannia and Paracelsus Medicina, or Medicina Paracelsia. Ultimately, both come together and become one. Slowly and steadily, what happened is that these organopathic doctors or organopaths who started using proving symptoms to understand the drugs, slowly and steadily, it converged, it emerged with homeopathic system. So in short, if you have to understand what is actually homeopathy, so homeopathy is nothing but organopathy plus something else. What is something else? Your PQRS symptoms, your location, your sensation, the modalities, your mental symptoms, the general symptoms, all the proving symptoms plus the organopathy. When you combine these two things, it becomes homeopathy. And that's how organopathy became an integral part of homeopathy itself. Hence, you will find physicians like Boric, Boger, you'll find many of them. You'll find pharmacodynamics of Hughes. These are all part of homeopathy. So homeopath cannot say that I will only read the proving symptoms, but the pathology is not important. And organopath cannot say that only pathology is important, symptoms are not important. To become a good homeopathic doctor, what we need basically is to include both of them and develop our understanding of drugs better and better. So seat of action, actually what we talk about in homeopathy, whenever we talk about the pathology, the seat of action, the organs affected, the organ affinity, you have to understand that it is a part of Paracelsus thoughts. And Burnett was highly influenced by this Rademacherian and Paracelsus thinking process. Of course, above that, he also was influenced by Hahnemannian thinking process. That's why he started using homeopathy. But in my personal experience, what I feel is that Burnett was a person who actually understood Hahnemann to its depth. And he was a person who actually combined the Rademacherian and Hahnemannian process. That's the reason why he gave wonderful results. Many myths about Burnett is there, which we're going to clear in upcoming lectures. So seat of action. So when we are putting efforts to understand Burnett, the first thing that we have to understand is seat of action. You will read his cases where he talks. Many a times he just gives remedies because it is seat of action is the most important. Liver remedy, heart remedy, kidney remedy, gallbladder remedy. There are remedies like this. Therapeutics, you might call it. This was one aspect of it. In my second video, I'm going to talk about kind of action.